Hello, I'm Dr. Joanna Betterton. I'm a GP working at Southmead Henbury Practice in Bristol, but I also have a special interest in child health and in particular childhood vaccinations. The MMRV vaccine is a vaccination that is given to children to help protect them against 4 diseases. These are measles, mumps, rubella and varicella. Varicella is a virus that causes chickenpox. A lot of our parents would have heard of chickenpox, or maybe their children may have had this. It is a virus that causes a rash and sort of flu-y symptoms like runny nose, cough and a fever. Most children who catch chickenpox or varicella will sort of have a mild, what we call self-limiting illness. But there are cases where children can become very poorly, leading to hospital admission, and this can be from a complication like pneumonia, which is a severe lung infection, or encephalitis, which is a brain infection. Now, as health professionals, we do see those cases, and that can be quite concerning, and which is very important why we protect children against varicella or chickenpox. I think it's really important for all parents to consider giving their child the MMRV vaccination. The reason is it protects against these diseases, not only from your child getting poorly and not feeling well from them, but also the possible complications. Now, we know that measles, mumps, rubella and varicella can all come with these complications, and some of these diseases can also be associated with disability, and they can even be fatal. So it's really, really important to protect children against these. The other factor that I always mention is the fact that with measles, we are seeing a rise in the UK at the moment, and actually we used to have a elimination status in the UK under World Health Organization, but that has now been stripped. So as a country, we are seeing those cases go up again. Measles can cause a severe brain infection and can cause disability, and also can actually cause a sort of long-term illness even later in life, years after you've caught measles, which is a progressive neurological condition which a lot of people don't know about. So that's why it's really important to protect people when they're young. Even if they did have a sort of mild version of the illness, they are still at risk of getting poorly later in life as well. As a health professional, my message to you as parents, carers and mums-to-be would be please consider vaccinating your child. This can help protect them against potentially serious illness and actually can even save their life. As a health professional, we do see very sad cases of children who haven't been vaccinated, and we never ever want to see that in an illness that can be prevented. So please consider getting vaccinated. The only thing I would say is it's completely normal as a parent to feel worried or unsure, and if you are, please just come and speak to somebody. No parent should ever feel judged about their decision or their worries, and you should always feel free to speak to someone trusted, and this can be your health visitor, your practice nurse or your GP, and there's also some really good resources online such as the NHS website, the government website, but also I'd really recommend Oxford Vaccine Knowledge Project, which you can just look up online. It's got some great videos and resources for parents as well. I am a mum-to-be myself, and therefore I do understand from that other aspect as a parent and not just as a health professional that you will want to do your own research and make those decisions for your baby or child, and that is something that I have done myself as well. I have looked up a lot of extensive research about the MMRV vaccine, and I can see it has been used for many years in other countries, including Australia and America. And so there's extensive safety data on it. And although it can be nerve-wracking hearing a new term, this is actually a vaccine that's been going on for many years. So me and my husband have made a decision to fully vaccinate our child when they're born and at the appropriate times. But it's also about protecting not only your own child but your family. And one thing that's really reassured me is that my sister made a decision to fully vaccinate her twins. And I'm an auntie to my beautiful niece and nephew. And the lovely thing for me is that when they are holding my newborn baby for the first time, I know that even though my baby might be too young to have their MMRV vaccination, the fact that my sister has made that decision is protecting our baby as well.